What concerns patients most?
Curiously, one of the things which patients are perhaps most often anxious about is anaesthesia. They're led to believe also that sedation is safer than anaesthesia. In fact, if you looked at the figures worldwide, it's probably less safe. The statistic is slightly skewed because, particularly in the United States, sedative procedures are often carried out in the doctor's office, so to speak, where the resuscitation facilities may not be the best. And so problems will often occur not because of what is being done as much as where it's being done and who's doing it. So if the surgeon is giving the sedation, to my way of thinking, that's dangerous for a start, because I want to think about what I'm doing. I don't want to think about whether the patient's breathing or not. I want somebody else to think about that. But people are very concerned about anaesthesia because I think you're completely handing over control of your survival to somebody else. But the statistics are that general anaesthesia, or for that matter sedation, carried out by an experienced, properly qualified anaesthetist in a properly equipped facility is exceptionally safe, safer than crossing the road or driving a car. But again, it's important to know that the person giving the anaesthetic is experienced and skilled. And it's a curious thing. I think it's really important that we work with a team. I often say team is the most overused word in medicine nowadays because everything is a team, and most of these teams are not teams actually. But certainly in my practice, I work with two anaesthetists both of whom I've known for a very long time. They're both very skilled, and we know and trust each other completely. So if one of them says to me, stop, not that it ever happened, but if they were to say stop, or were to say, I don't think we should operate on this patient, we wouldn't, because I trust their judgment completely. And by the same token, they trust what I do and they know what I do. So the anaesthetist is a really important part of the surgical team, and in this kind of surgery, the anaesthesia is very important because of the conditions that the anaesthetist will create for the surgeon. Blood pressure needs to be stable. If the blood pressure is going up and down, patient bleeds, complications are more common. It's actually, this kind of anaesthesia is very skilled, and I can tell you that the anaesthetists who are very good at it are very good at it. And of course, we're talking about teams. There's also the girls in the office, my nurse, and all of this, and the nurses in the hospital on the ward, and all of these things coming back to complications. You put all those things together, and you put all that experience together, and you help to reduce complications by understanding and a pooled experience.